There are a lot of things to consider when expecting to become a mother. Prenatal care is especially important during this process. Prenatal care is the health care you get while you are pregnant. It includes your checkups and prenatal testing, as well as things you should be monitoring during pregnancy. Prenatal care can help keep you and your baby healthy and lets you and your healthcare provider spot health problems early on. One of the things to consider during pregnancy is managing your mental health. During pregnancy or postpartum, many women experience depression, anxiety, intrusive, repetitive thoughts, panic, or post-traumatic stress. These symptoms are completely normal, and it's important to note that every prenatal, perinatal mood disorder, no matter how strong the symptoms are, is temporary and treatable. Treatments that might help moms dealing with prenatal mood disorders include increasing self-care, social support, and counseling, as well as various medications. If you need help right away, the Suicide Prevention Lifeline can provide immediate services. Many expecting mothers also have concerns about their eating habits and diet during pregnancy. Nausea and vomiting are extremely common concerns during pregnancy. Nausea can be combated by changing food and fluid intake. This is a matter of listening to your body and changing your diet based on what works best for you. Vomiting can be reduced by taking vitamins and over-the-counter medications. You can also call your care team to talk about a prescription if you keep having problems. Heartburn and constipation are also common concerns during pregnancy. Both heartburn and constipation can also be reduced by changing your diet and taking over-the-counter vitamins and medications. It is also important to maintain your physical health during pregnancy. Being completely inactive can increase risk of other problems, including blood clots. Exercises such as yoga, Pilates, swimming, and walking leads to many benefits, including reduction of pain, constipation, and preeclampsia. You should still talk to your provider and take precautions when participating in physical activities. Pregnant mothers should also consistently monitor their blood pressure. A blood pressure of 140/90 is considered as hypertension and can lead to many issues before or during delivery. High blood pressure puts you at risk of heart and kidney disease, stroke, fetal growth restriction, preeclampsia, placental abruption, and cesarean delivery. It is important to monitor your blood pressure at home and notify your provider of any high blood pressure measurements or concerns because it can affect your health and your baby's health. Abdominal pain is a sign to take note of during pregnancy. Normal abdominal pain can be treated with medications, hot and cold packs, and stretching. Abnormal abdominal pain includes severe abrupt pain and heartburn and does not respond to regular treatments. If you have any symptoms or of abnormal pain, contact your provider immediately for an evaluation. Headaches and swelling are also normal during pregnancy. Normal headaches can be treated with medications, hydration, compresses, and sleep. Abnormal headaches and swelling are associated with brain swelling and do not respond to regular home treatments. Preeclampsia is a syndrome experienced by some pregnant mothers and requires intensive monitoring because if left unchecked, the symptoms can lead to drastic health consequences for you and your child. Symptoms of preeclampsia include persistent headache, gaining more than 5 pounds a week, hand or face swelling, blood work for HELLP syndrome, visual disturbances, proteinuria, impending doom feeling, and upper right quadrant pain. Preeclampsia is diagnosed by 2 blood pressure readings of 140/90, at least 4 hours apart. Please contact your provider immediately for an evaluation if you experience any of these symptoms or if you are unsure. During pregnancy, you should be seen every 4 weeks by a provider until you reach 28 weeks. Then you will be seen every 2 weeks until you reach 36 weeks. After that, you will be seen every week until your delivery. During the first trimester, the first couple exams will take the longest. During the second trimester, blood pressure, weight, and heartbeat will be measured at each exam. During the third trimester, blood pressure, weight, heartbeat, head position, and growth will be measured at each exam. It is important to follow through with the checkup schedule with your provider to ensure there are no underlying health problems during and after your pregnancy. During your appointments, make sure to ask your provider questions like, can you put everything in writing so that I can refer to it later? What symptoms should I be monitoring at home? What treatments are available to me? Can you explain more to me about what you are seeing that tells you I am okay or not? What tests should I get done? This makes sure that you are educated and can effectively take care of yourself and monitor important signs and symptoms at home during your pregnancy. Detailed resources in prenatal care and additional women's health topics can be found in the links included below.